My name is Aaron, and today I'll be presenting a case study on Kai, a 3-year-old child admitted with acute gastroenteritis and significant dehydration. This presentation will explore the likely condition, key assessment priorities, and how biopsychosocial factors influence nursing care. In this case, Kai presents with a 12% body weight loss following gastroenteritis. This level of fluid loss is clinically significant and indicates moderate to severe dehydration, requiring immediate and carefully planned nursing intervention. When identifying relevant health concerns, the primary condition is acute gastroenteritis, with dehydration and potential electrolyte imbalance as key complications. Although common in children, these conditions can escalate rapidly if not managed appropriately. The most likely condition here is significant dehydration. A 12% reduction in body weight strongly aligns with pediatric clinical indicators of a critical fluid defect that requires urgent and effective management. This condition develops due to ongoing fluid loss from vomiting and diarrhea in young children. Higher metabolic rates and lower fluid reserves significantly increase the risk of rapid dehydration and clinical deterioration. To fully understand Kai's condition, it is important to apply a biopsychosocial approach, recognizing the biological, psychological, and social factors all interact to influence both illness, experience, and recovery outcomes. Looking at biological factors, Kai's young age increases vulnerability due to immature kidney function, higher fluid requirements, and limited physiological reserves, all of which contributes to faster progression of dehydration. From a psychological perspective, hospitalization can be distressing for toddlers. Fear, anxiety, and separation from caregivers can lead to resistance, irritability, and difficulty cooperating with care. Socially, family plays a crucial role in Kai's recovery. Parental presence provides emotional reassurance, while cultural beliefs and health literacy may influence how illness is understood and managed. In terms of nursing assessment, the main focus is identifying the severity of dehydration. This includes monitoring vital signs, capillary refill time, urine output, mucous membranes, and overall clinical presentation. Accurate fluid balance monitoring is essential. This involves recording intake and output carefully, as well as measuring daily weights to assess response to treatment and guide ongoing management decisions. The primary nursing intervention in this case is fluid replacement therapy. Restoring circulating volume is critical to stabilizing Kai's condition and preventing further deterioration. For mild to moderate dehydration, oral rehydration therapy is preferred. However, when dehydration is severe or oral intake is not tolerated, IV therapy becomes necessary for rapid correction. The main risk being addressed includes hypovolemic shock, electrolyte imbalance, and continued clinical deterioration. Early identification and timely interventions are essential to prevent serious complications. Addressing psychological needs is equally important in this case. Young children often experience fear and anxiety in unfamiliar hospital environments. Using simple age appropriate language, play based distractions, and familiar comfort items can help reduce distress and improve cooperation during care. Providing emotional reassurance also supports a more positive healthcare experience. Family centered care is a key principle in pediatric nursing practice, actively involving parents in comforting the child, supporting hydration, and participating in care decisions helps improve both emotional and well-being and clinical outcomes. It also builds trust between the healthcare team and the family. Cultural safety must also be considered when delivering care. Nurses should respect family beliefs and practices while ensuring care remains safe and evidence based. Using clear communication and translators when required helps create an inclusive and supportive healthcare environment for the child and family. Considering an additional contextual variation, if there's a concern that Kai may be experiencing abuse, this significantly alters the priorities of care. The focus shifts beyond clinical management to also ensuring the child's immediate safety and well being. In response, the nurse must remain vigilant, observe for any signs of harm, and document findings accurately and objectively. It is essential to follow mandatory reporting guidelines and escalate concerns to the appropriate safeguarding and multidisciplinary teams. Ultimately, care priorities shift towards safeguarding the child. This requires a multidisciplinary approach involving social workers and healthcare professionals, while continuing to provide essential clinical treatment and emotional support to ensure holistic care. Thank you for listening.